What are the 3 things that every practice should do when it comes to marketing and operations? First of all, you should never market your practice unless you know your operational numbers. So if you don't even know the average number of new patients you're getting a month and production, collections, you don't know what your reappointment rate is or your cancellation rate, you need to know those numbers prior to even getting involved in marketing, because those numbers are what's going to feed your marketing company to understand how to approach your practice and what strategy to take. Second, you want to look at your phone numbers. If you can then identify, okay, I'm getting 1,000 calls per month, I'm answering 700 of those, so that's 70% answer rate. That right there gets you an idea of where your staff is at and how much opportunity you're leaving on the table. Because if you're leaving 300 calls on the table, that's a possible 15, 20, 25 new patients that you're not even answering the phone for. Then once you have that information, you take that with your marketing company and you start to create a plan and you start to know those marketing numbers. So for example, if you're answering 90% of your calls, you're a high performer. So what do you do with that information? At that point, you know that you can then feed the practice, the marketing company can feed the practice as many new patients as possible because you have a high answer rate. And you know you're gonna get those patients in. So knowing those numbers is key. The other numbers to know too is when you have a capacity issue. So if you are able to see 100 new patients a month, and you're sitting at 70 right now, you know you can, if you're block scheduling, you know you can see 30 more new patients. But if you're at 100 new patients and you block 100 new patients and you're getting 100 new, then you can take that information to make decisions to go after emergency patients or going after different types of patients to allow you to increase your revenue without having to increase your hygiene patients. So know your numbers from your practice, your phones, and your marketing. Take that information and you will have the most successful marketing campaign you can with the highest amount of ROI.